Welcome to MEDIMAGZA The Podcast, where healthcare meets a lifestyle. Today's guest is Dr. Bonginkosi Mafuze, psychiatrist, educator, and advocate for mental health innovation in South Africa. Now, Dr. Mafuze holds multiple qualifications and several diplomas spanning mental health, HIV management, and even football medicine. We're thrilled to have him here, of course, to talk about his journey, his work at the intersection of psychiatry and sports, and his vision for the future of mental health in Africa. Dr. Mafuze, so glad to have you with us today on MEDIMAG the podcast.
Hi, Clive, and good day or hello to the viewers and listeners of MediMac. I'm really honored and pleased to be part of this conversation.
Fantastic. Doc, I'm going to start straight out the gates. Can you share a bit about your journey into psychiatry and what inspired you to specialize in mental health?
It's actually a very long journey, but I'll try keep it short. Psychiatrists love to talk and ask questions and delve deep, but I'll just try and summarize. I actually figured out at the end of my internship that I have a passion or a liking of psychiatry. Then when I had to do my community service, I had put psychiatry as one of the options, but my other likings was cardiology and anesthesia. So I was like, God, wherever you put me, I'll take it. And then I was thrown into a psychiatric hospital for community service, which I think was just a blessing. So with psychiatry, I just felt that with me, I live on a motto of contribution is the ultimate purpose of life. So I did see a space or a gap in the mental health space within our communities. So I felt like I could be that agent of change or that agent of bringing awareness about mental health within our communities. So I think that was my main aim of going into psychiatry.
That's really remarkable, and I can imagine the length of the journey that you've gone through. You've pursued additional training now in both sports psychiatry and football medicine. How do these fields intersect, and why is mental health in sports so important?
Um, yeah, so I must say, in my community service, I actually applied to do sports medicine, to be a physician in sports medicine, because I have a liking and loving for sports. However, I think because of little experience at that time, it was unfortunately declined. Then I started researching and being searching as, okay, I've got this thing of mental health, and then now I've got this thing of sports. How do I put them together? Then I found out that actually there is a field of sports psychiatry, but none in Africa. So I was like, how about I equip myself and I registered to do the certificate in sports psychiatry with the International Society of Sports Psychiatry, where I was gathering more information about what's happening. And I wanted to be one of the pioneers of sports mental health within our context. And I figured that with sports, the nice thing is we look up to athletes as laymen or as citizens of South Africa and Africa in general. And we tend to think these are people who are so resilient. They are gold medalists. They are 3 times Rugby World Cup champions. But they also have this concept of vulnerability. So having them as ambassadors and having them as examples to come out into public and say, look, I've got this mental health issue. And as much as I am this elite person in society, but I have this vulnerability. And I feel it speaks to us also to say, then who am I? I'm not up there. I'm not doing such great things in the world. Who am I not to have that mental illness? So it tends to break down the stigma. So I think sports unites a lot of people, and I think it's a vessel to break down stigma. And I think within the sporting arena, like I said, even apart from the medical care that athletes face, mental health tends to be quite ignored. There's a lot of fitness tests that are done, like you hear that someone is going for medicals, but never someone going for a mental fitness test, you know? So I really thought that it's a niche place where I can bring it into our context, and it would be something where I know that I've contributed within the field, because I really believe we shouldn't leave the specialities we're in the same way that we found them.
That is beautifully put. And I think nowadays it's so important that these important stigmas are being broken. You know, I think as sportsmen, even in the field of being role models per se, I think mental health is so important for them to talk about as well, because they are real people at the end of the day with real issues. So I think it's really important for them to talk about it. As a co-founder of Yunibo Health Trust and Doctors of Minds, what motivated you to start these organizations and what impact are you aiming for, Doc?
So actually, Yunibo Health is a trust that I founded with a friend of mine, Yusuf Khatib. We were third year medical students at that time, and we were doing our clinical practicals, and we had a volunteer, one of the locals who had a heart problem, my love for cardiology. So we aimed to partner with one of the local hospitals through their corporate social investment. And we assisted this young girl who was told that with her heart problem, she could never bear children again because it was so dangerous and all of that. And she couldn't afford to have that procedure done. So through our partnership with a private hospital, she had a double open heart surgery, which was worth around 300,000 Rand. This was around 2014. So our aim with Yunibo Health is to foster the public-private partnership and to give people who are at need of more services where they can't access through the limited supply of or the limited availability of services within the public health sector. So, and then with doctors, so that's with cardiology with Yunibo Health. But we were also doing other specialties. So we've done Operation Smile, we've done Colgate, we've painted wards in hospitals. So it's more of an outreach program or project. Then Doctors of Minds was inspired by the late Dr. Bongani Mayosi, who is presumed to have had a mental health breakdown leading to him passing on, where my mentor, Dr. Judy Dlamini, authored a book called Doctors of Hearts. So then I was like, okay, if we have Doctors of Hearts, how about we have Doctors of Minds? So with Doctors of Minds, we looking at lived experience. So we want mental health persons who suffer from mental health challenges to share their lived experience, because I feel when it's us healthcare practitioners sharing knowledge and educating, people tend to forget a lot. And when it comes to persons with experience, I feel their expertise of experiencing the issues tend to sit better with people. People tend to listen more to someone who's experienced something rather than us speaking from the point of view of seeing multiple patients or reading from textbooks. So Doctors of Minds is about sharing stories and reducing the stigma in terms of lived experienced persons coming around and sharing what they've been through.
That's remarkable, and I completely agree with you there. I think coming from a place of experience resonates so much more with the person you're talking to because you can talk the same language, you know, per se. Tell me, what are some of the biggest challenges facing mental health in South Africa today?
Sure. Okay. I think one is mental health care access. We have very, very, very few mental health care practitioners. So this stems from psychologists, occupational therapists, nurses trained in psychiatry, psychiatrists themselves. Like if I were to tell you the ratio, in the country, we only have about just less than 1,000 specialist psychiatrists, of which more than 50% of them are based in private practice. And then the ratio is one psychiatrist is to about 100,000 persons. So it is so limited. And of the persons with mental illness, there's only about less than 5% that will eventually see a specialist in their lifetime of having the illness that they may be suffering from. So I think access to services is very limited because of limited personnel. And I think also it's the way with stigma, another big challenge. People tend to shy away on, they do not want to be labeled as having a mental health issue. It seems to be, oh, why can't you just get over it just because no one can see it? But obviously we see the impact that it has. So stigma and access seem to be the major big challenges. And obviously policy in terms of investment into mental health is also quite a big problem because when it comes to mental health, what the World Health Organization or the United Nations suggest is that they should at least, out of the health budget, about 10% of it should be going towards mental health. And in our setting, we have less than 5% that is actually allocated to mental health services. So it'll always be a problem. And the thing is, mental health intersects in all specialities that you go into, be it pediatrics, be it gynecology, be it orthopedics. Whatever you do to a patient will affect their mental psyche and in terms of recovery and all of that. So there's a lot of mental health in all spaces of healthcare. And I really think it's one of the specialities that we should be investing more in.
I love that you say, even though you don't see it, it doesn't mean it doesn't exist. That is actually so important to touch on because I fully believe that as well. How do you approach breaking the stigma around mental health, especially amongst young people and athletes for that matter?
So breaking stigma is one of the primary prevention strategies, because if we normalize mental health talk, if we normalize mental health illness, and if we normalize that we all can be vulnerable, then it would be easy for people to seek access. And you know, one of the nice things with athletes, Africa's fastest sprinter and silver medalist at the last Olympics, Akani Simbine, was actually in September now selected as one of 9 Olympic medalists in the world to be a mental health ambassador for the International Olympic Committee. So it is something that is really realized that young people, when they see Simbine, they see this amazing gentleman representing our country, and having him there to stand up and say, look, I do have a mental health problem and I'm seeking assistance. I have not performed at my best at certain times. After seeking help, I was able to improve on my performance. Then someone young looking up to him will be like, maybe I've also got a challenge. Let me go get help. Let me go seek help. So the same way, like when someone trips and falls and gets a cut, they go to the hospital. I feel like if we raise enough awareness where people realize vulnerabilities in their mental health, they can stand up and go seek assistance also.
I really love that, breaking the stigma. It's really so important. Now, you've completed a diploma in HIV management. How does HIV intersect with mental health in your clinical practice?
So the idea when I did the HIV diploma was, I always look where the problems are, and then I try and fit in and see what change I can make there. So I realized HIV is a huge pandemic globally, more especially in South Africa, more especially in KwaZulu-Natal, the province that I'm in. So I just needed to upskill myself more of what really happens. So when I figured that HIV can actually seep through and affect the brain, so it can cause mental health problems, could be depression, it could be psychotic disorders. So a lot can happen from just the illness itself. And then secondly, the nice thing is the change in the HIV tablets that I use now. Previously, we used to have drugs which had a side effect of causing psychosis. So now the new drugs that are out in the market are more mental health friendly than before. So directly the illness, the way the illness is treated, and just having the diagnosis of a chronic illness like HIV can lead to mental health problems. So I knew that with such a high incidence of HIV, there must be a market for it. There must be a niche. There must be some way, somehow, I can bring in my mental health expertise in that area and try and assist in that space of HIV.
That's remarkable. Such a nice holistic approach to it. Can you share a story or moment from your career that really affirmed your commitment to this work?
So I think that would be from the beginning. So when I was born, I was actually diagnosed with a heart problem, which is I think why I ended up loving cardiology because with that heart problem, I missed out on school a lot with assessments with the doctors, and then they said I had a hole in the heart, and then from there, I was like, even through sports days the teachers wouldn't allow me to run as fast as other kids. I was just having this special care, and I was like, I don't like all this attention. So in my mind, growing up as a child, I was like, one day I don't want kids to experience what I experienced, you know? So that was my motivation to get into this space. And then when I was in the space, I then found another passion in terms of mental health, where I noticed people around me, cousins or relatives, having these mental health challenges. And I realized how difficult it was to access the care. So when I reassessed the need and my contribution, especially in the African context where mental illness is not really understood, I felt like I have more of a need in the mental health space than in the cardiology space. So I think those experiences, personal and those that around me, really reaffirmed my liking for psychiatry. And then in retrospect, I realized actually, even in medical school, my highest mark was psychiatry. And I didn't even know until I was looking at my academic record. I'm like, oh, wow, psychiatry has been creeping in there, just that I didn't know, you know. And then now, currently, I am the first in the country to have a certificate in sports psychiatry. So I just feel it is, in a way, the things happening around me and through my experiences, it just keeps reaffirming that I feel like I am in the right space.
Definitely a remarkable trailblazer, which is gonna take us into the next question. You've been nominated for the Rising Star Healthcare Professional of the Year award. So congratulations on that one. What does this recognition mean to you personally and professionally?
Yeah. I was really honored when I received the email. I was like, am I a rising star already? Because at first I was like, I feel like I'm too young to be in that category. But I was really honored and really felt like my work probably speaks for itself. The people around me, the support I get, the mentorship I've received, all of it really contributes to it. So it's not all just me in this nomination, but it's just a testimony of the work that's been put into the individual that is really trying to do their best and contribute to society. So I'm really humbled and honored to be nominated as a rising star. And I really hope that I do not disappoint and I'll just keep on rising. And I live up to the words of Dr. Bongani Mayosi, who says, you must lift as you rise. So mentorship is one of the things that I really, really think are pivotal and critical in anyone's career.
Lift as you rise for sure. What advice would you give to young healthcare professionals or medical students who want to make a difference in mental health?
So it's to get involved early. I think that's the most important thing. Get involved early. Don't feel like you don't know anything. there's always an opportunity to learn. It's all about lifelong learning. Every step you go, I went into sports psychiatry not knowing what's going on. I had no one to teach me locally. So it's taking every opportunity that presents itself and to aspire to inspire before you expire.
Wow, that you should coin that phrase. Looking ahead now, what are your hopes for the future of mental health care, both in South Africa and across the continent?
I think my hopes are to really establish the sports mental health space. I think with South Africa slowly growing into becoming a pivotal sporting nation, we can use sports, one, as a vehicle or tool to unite people. In that unity of people, we can present the concept of mental health. So I really wish uh, for in every sport at every level, be it recreational sports, elite sports, that mental health really does creep into that, such that persons can really understand that in sport, it's not always just about winning, but to enjoy ourselves while we are within that space. So I really feel that with that vehicle of sports mental health, we can break down stigma, we can unite people, our country can just be something else. I mean, we saw when South Africa won the Rugby World Cup, the entire country came together. We forgot about the things that divide us. We forgot about the difficulties we have. So I think that's the power of sports. And internationally, I think mental health is slowly getting the attention it deserves. So I really think also in a global scale, sports mental health is the way to go for us to reach out to as many people as possible in the shortest space of time. Gone are the days where it's the responsibility of us as professionals to educate, but we need to now encroach spaces where the message gets sent louder, the message gets sent faster. So even apart from sports alone, your media houses, your soapies on your television and radio, the concept of mental health keeps on creeping in because we want to get the message out there.
No, definitely, Doc. I think those were such inspiring words and so much to take from this remarkable interview. But there you have it. Thank you, Dr. Bonginkosi Mafuze, for sharing your insights and passion with us today. If you've been inspired, of course, by his work, you can help support his journey. Dr. Mafuze is nominated again in the Rising Star Healthcare Professional category for the Healthcare Excellence Awards. To cast your vote for him, simply SMS AHEA 001 to 34855. And don't forget to subscribe to MEDIMAG The Podcast for more inspiring stories and expert health insights. Thank you so much once again, Dr. Mafuze.
Thank you very much.